the data with ablation of paroxysmal atrial fibrillation is there is a large number of data. However, the data is lacking for persistent atrial fibrillation. So knowing the optimal procedure for persistent atrial fibrillation, knowing the outcome of persistent atrial fibrillation in a large multi-center study is relatively unknown. The PRECEPT study is the first multinational, multi-center, FDA-sponsored study for persistent atrial fibrillation. We have significant data on the treatment of paroxysmal atrial fibrillation, but the data for persistent atrial fibrillation is lacking. So the aim from PRECEPT study is to demonstrate the efficacy and safety of catheter ablation for persistent atrial fibrillation in a multi-center prospective design. The PRECEPT is the first multi-center study for persistent atrial fibrillation under FDA sponsorship. Many studies were done for paroxysmal atrial fibrillation, but none has been done with persistent atrial fibrillation. 26 centers were enrolled in the United States and Canada, in excess of 380 patients. It has a prospective design. Follow-up was 15 months, which is extensive. And also the patient had a very meticulous follow-up, including frequent ambulatory monitors and testing. The follow-up is also unique, and it is geared toward a persistent population study. And the design of the study was later incorporated into the atrial fibrillation ablation consensus guideline, and I will elaborate on that a little bit. So the study had a 15-month follow-up. Most of the studies of AFib ablation had only a 12-month follow-up. And the reason for the 15-month follow-up is because we had in PRECEPT 6 months blanking period instead of 3. And I will tell you what the reasons are. In most patients with persistent atrial fibrillation, after ablations, some of the investigators or operators may use some medications in the first 3 months. We did not want the effect of the medications to be carried over and dilute the effect of ablation. As a result, we extended the blanking period to 6 months, so they will have no more effect of the medications that some of them could have been used in the first 3 months. And because of that, we extended the follow-up to a total of 50 months, which I believe is very adequate. The study had 2 endpoints, a primary safety endpoint and a primary effectiveness endpoint. And both endpoints were met. For the primary safety endpoint, the complication, the adverse event rate was very small, and it beat the expected number of safety events. The primary effectiveness endpoint, which is a very strict endpoint consisting of no freedom from atrial fibrillation of no more than 30 seconds, was achieved in 61.7% of the patients. In addition to the primary effectiveness endpoint, we also had a clinical success endpoint, which may be more relevant for patients with persistent atrial fibrillation, where the 30-second rule may not apply well. And in this study, in PRECEPT study, this clinical success endpoint was reached in 80% of the patients. Many of us don't believe that the 30-second recurrence rate of atrial fibrillation may be relevant for patients with persistent AFib, but we also know that this is the standard that needs to be followed by most societies and by most clinical trial regulatory foundations or institutions. So we had to show that, but also we showed a clinical success endpoint. In addition to the primary safety and primary effectiveness endpoint, We also looked at the quality of life. We looked at the rate of redo ablation, and we looked at healthcare utilization, and we found that ablation of persistent atrial fibrillation improved all those endpoints. We learned a lot from the PRECEPT study. It is the first prospective study, multicenter, for persistent atrial fibrillation ablation. It showed that ablation, when performed with a contact force catheter, is associated with a low complication rate and provides a high level of effectiveness. We also showed that ablation improves the quality of life of the patients, reduces healthcare utilization, and is associated with a low rate of recurrence.